Christmas Day, Kawhi Leonard took a brutal elbow to the face by his teammate Ibaka, taking him out for 2 games. Now, I wanted to talk with you a little bit more about his injury and then discuss why he came back wearing a face mask. For those who don't know me, my name is Sonam, and I am a resident doctor specializing in sports and exercise medicine. I like to break down injuries so that an average fan can better understand the anatomy and biomechanics at play. If you want to see more videos like this, please subscribe to my channel. But for now, let's get back to discussing Kawhi Leonard's injury. So let's take a look at the footage from above, because I find that it shows the injury the best out of all the viewing angles. Okay, so here we're at the opposing team's basket. Kawhi's right there, and you'll see the elbow impact. It's quite quick, but it puts him down to the ground pretty quickly. And we'll go back here. We'll see if we can find a stop frame there. So this, approximately around here, is where that impact takes place. Do is we'll pause it. Yeah. So this is where this impact takes place. So it seems that he had the elbow to the face on the left side, coming up from the jaw as the elbow went up. Now after he's hit, Kawhi gets down to the ground pretty quickly, almost like he collapses. Now, as a doctor on the sidelines, the first thing I'm thinking is, has he lost consciousness? Because that's the type of injury I need to rule out ASAP. If an athlete gets hit in the head, and if they lose consciousness, you need to rule out a pretty severe brain injury or the beginnings of a concussion, which are automatic withdrawals from game. Good thing is, it appears that on the sideline footage, he was moving around. While there was appreciably a lot of blood there, he was with it, moving around and still active, which are actually good signs to a doctor when we go and treat these patients on the field, or the court in this instance. Now, news reports stated that the athletic trainers were quite concerned about a potential head injury, just given the way that he fell down and the level of blood that was on the court. Well, we'll discuss a little bit about why he had bled so much, but it turns out Kawhi was fairly lucky in that he only suffered a laceration or a cut to the inside of his mouth. So you're looking at kind of the gum side here, which required approximately 8 stitches. And with what we saw, people thought it was a lot worse, but we'll go over the injuries to consider, and then kind of overview the laceration or the cut inside his mouth a little bit more. So in terms of the injuries that Kawhi could have sustained, as a doctor, if I see a patient going down like that, these are the first few things I'm thinking of. So number 1, you want to look at the mechanism of injury. We saw that there was an elbow to the face with quite a lot of force, as you saw Ibaka jumped up to try to get that rebound. So if you look at injuries that happen with elbows to the face, pretty much bone on bone you're thinking, the number 1 thing we want to rule out is a fracture. So let me show you here a little picture of a human skull. And this is us looking front on, but I want to show you, and I want you to appreciate that our skull is made out of multiple bones. Now, the number 1 bone fractured in sports and in most facial injuries is actually your nasal bone. So that's the bone right on top of here, if I show you in a little bit more detail. The ones that we're more concerned for, though, unfortunately, and in Kawhi's case, are fractures to his mandible. So you're thinking the jawbone, and also fractures to the mid-face bone. So you're going to see me highlight them right here. And the reason why these ones are so important is because there's multiple blood vessels and nerves that go through the area. I'm going to show you there's 1 hole here, 1 hole in the midface, and 1 hole on the jaw. Those 3 holes are areas which nerves come out of. And if you have fractures in that area, those bones, when they break, can sever the nerves. So it's an important area to keep in mind. The other consideration when it comes to fracturing bones around the eye is the eye muscles themselves. So this is an eye socket right around here. And if you were to fracture either this or this bone here, which is your maxilla or your zygomatic bone, think about it this way. These go straight into the eye socket. The eye has a series of muscles that attaches to it that lets my eye look left, right, up, and down. And that's what doctors are assessing, the function of those muscles. If you have a fracture in this area, you can actually break some of those muscles or get them stuck so that the eye can no longer move appropriately. You can also go as far as to damage the eye. So these are injuries that we screen for really quickly by assessing the face and the eye muscles, so that we can rule them out. The second injury that I'd be concerned about with an elbow to the face is a concussion or a brain injury. So the first thing I'm asking myself when I see an athlete go down with a brutal head injury or a brutal impact to the face is, have they lost consciousness? Can they answer some questions? I take them off to the sideline and I do a minor a quick concussion assessment. At this point in time, I'm withdrawing these guys from the game because we know that if someone has symptoms of a concussion, putting them back in will just promote worsening of that condition. Now in Kawhi's case, the news reports and articles afterwards state that he was there were no symptoms of concussion afterwards, which is why he was able to go back 2 games later, which is a good sign. So the third injury that I'm thinking about are broken teeth. Very common in any sport that involves combat. So you're thinking UFC, boxing, and any sort of fighting sport. But when you have these types of injuries, such as elbows to the face, you just want to rule it out and make sure that there are no broken teeth. He accidentally had to not swallow any broken teeth. And if there are, take them out, put them on saline, which is just a little bit of salt water, and send them to a dentist. Most teams have an emergency dentist on call that can put teeth back in pretty much right after the game. The last injury that I'm thinking about is a laceration to the skin. What's a laceration? It's a fancy word for saying cut. So Kawhi didn't have any cuts on the outside of his face, but he did have one on the inside. Now, how did that happen? So if you look at, I'm going to show you my gums here, the inside of my mouth. You'll have my teeth, and then you have my gums. If you have an impact, for example, an elbow to the face, the teeth will cut straight into the gums, resulting in a cut in the internal aspect of the mouth. So injuries to the face and scalp bleed quite a lot because we have an enormous amount of blood flow that goes to our face and our brain, primarily because our brain needs so much blood and oxygen to survive. So while these look extremely severe on the court, it's actually a good thing that they bleed so much because they heal so much quicker. So in terms of the treatment that Kawhi received, all he needed were approximately 8 stitches to the inside of his mouth to stop the bleeding, and that was about it. So while the injury looked pretty gruesome on video, his treatment was fairly simple and may have been done in the back of his locker room or in the emergency department, depending on what level of care and equipment that they had on site. As a rule of thumb, as doctors, whenever we're closing up things, we say that stitches on the face can be removed in approximately 5 days. Stitches on the scalp can be removed in 7 days. Anywhere else on the back of the body, anywhere from 10 to 14 days. So what I'm trying to say is anything on the face and scalp heal that much quicker. And this is likely why Kawhi was able to return back to playing after 2 games. So to really summarize, many people would ask how long would Kawhi be out for an injury such as this? The main thing is, since we ruled out all the big and bad injuries like concussions and fractures to facial bones, he had pretty much a cut that just needed to be closed up so that we could get some hemostasis or closing of the actual blood flow and allow healing to occur. Usually in about 5 to 7 days, the area would start to close up and you could remove any stitches depending on what type of sutures they used in the mouth. Now, Kawhi has actually, in fact, returned to playing, and he's been using a facial mask. Let's take a look at the mask that he's using. Okay, so this is a picture of the mask that Kawhi is using here. And I know he's been catching a lot of flack for wearing a mask like this, but to be honest, the decision he had was he wasn't fully healed and cleared as per the doctor's point of view. So we had 2 decisions. 1, not play, or 2, play with the mask. And I mean, as an NBA athlete who gets paid to play and a star player of the team, his priorities are going to be getting back on the court and getting some wins for his team. So he opted for the facial mask. And if you take a look at the mask that Kawhi is wearing, it's particularly protecting his lips and his teeth because that's the area that got cut. Most people are making fun of the open area on his eyes or nose, but likely he had that open so he could breathe and see appropriately. Now, if he had a broken nose, for example, that would mean that the mask would need to mold over his nose to protect that area. This mask was quickly fashioned just to protect the area around his mouth where he sustained a laceration. He may not need to wear that mask for more than just a few games, and I mean, a lot of it is going to be depending on his comfort level. if he feels like he needs that mask on for a few more games. The only thing he's really losing is comfort, to be honest, and he's gaining safety. So at the end of the day, he's playing it safe, he's getting wins for his team, and he's trying to avoid any other further injury, which in my mind is probably the right way to approach things. Now, if you like this video, please click the like button. If you want to see more videos in the future where I break down the anatomy and biomechanics of injuries professional athletes face so that an average fan can better understand them, please subscribe to my channel. For now, that's all. Happy 2021, and I'll see you next time.